Welcome back to the Doc Talk. And if you're a longtime listener, you know what that means. It's time for our final episode of season 2. And we've saved the best for last because today it is entirely your show.
So today we put out a listener call out asking for all of your GLP-1 Ozempic questions. And honestly, we were blown away. The questions were thoughtful, personal, and sometimes surprising. And they told us everything we need to know about what people are actually thinking about and asking about this topic. But first, a word from our sponsor.
Figs. We want to take a moment to thank you, our season sponsor. And honestly, this is an easy one for us because we actually wear figs to work. Their scrubs are comfortable, flattering, and genuinely cute. We get compliments on them all the time from patients and colleagues, especially every time I have a new color. Everyone's like, oh, that's such a great color. And
yeah, no one ever compliments me on anything else I wear except my figs.
Truly. And I always try to color coordinate too, so it's so great. They're incredibly practical. The pockets fit everything I need, foams, notes, pens, everything. And on colder days, especially in hospital hallways, with the AC coming around during the warmer months, the layers really do help keep us warm. Their compression socks are another staple for me, supportive enough for long shifts, but still cute. Same with their hair accessories, the headbands, the claw clips, the scrunchies. They actually keep my hair in place and out of the way.
And I really love their work bags, Shaz. Like, they are so thoughtfully designed with multiple compartments to hold everything that you need, from my stethoscope to my gear to my power-up snacks and a change of clothes. And if you don't work in healthcare, the Figs Lounger set is beautiful. It's thick, soft, high quality. I got my husband a set and he loves it as well. If you work in healthcare or you're shopping for someone who does, Figs just makes sense. Go to wearfigs.com and use code FIGSDocTalk to get 20% off your first order. That's wearfigs.com, code FIGSDocTalk.
Okay, so before we dive into all of your amazing questions, we actually want to set the stage, make sure everyone's on the same page, whether you've been following GLP-1 conversation kind of over the years, or you just started hearing about Ozempic at dinner parties or on social media and are wondering what the fuss is all about.
And I really love this topic, Shaz. I'm so glad that we're covering it because as a family doctor, I'm prescribing this to my patients regularly. We're having long conversations, and we're also carrying a lot of misinformation in our offices. And I'm sure you're seeing this a lot through the emergency room of patients who are on these medications as well. So when we dive in, let's start with setting us all level set for everybody with a quick overview of what GLP-1s are.
So I think this is great. So GLP-1 stands for a glucagon-like peptide 1. And so before your eyes glaze over, we're not going to stick with us. We're not going to go into the, biochemistry of it, but the biology of it is actually really cool.
So GLP-1 is a hormone that your body naturally produces, mainly in your gut after you eat. Its job is to signal to your brain that you're full and to tell your pancreas to release insulin. And that slows down, and it also slows down how fast your stomach empties, and it reduces the amount of another hormone called glucagon. So we're mentioning a lot of hormones here because we're a bit nerdy about this, but it is really interesting to know this. And glucagon is the hormone that raises your blood sugar.
So in a healthy system, the GLP-1 is essentially your body's built-in appetite and blood sugar regulator. So it suppresses your appetite, it regulates your blood sugar by kind of balancing that insulin and glucagon balance. And then the medications that we call GLP-1s are actually synthetic versions that mimic or enhance that hormone's effects, but in a much more powerful and sustained way than what your body produces naturally.
And what's fascinating about this medication is that it was actually first developed for type 2 diabetes, and it was to help control blood sugar, and it works really well. But at the same time, when people were using this for type 2 diabetes, researchers also noticed that it was also causing meaningful weight loss. And that's when the conversation shifted.
And the interesting thing here for me is that it's not the mechanism of weight loss isn't just eating less. It actually changes how the brain is receiving signals. So specifically, there's a part of the brain called the hypothalamus, and it's receiving a stronger and longer kind of I'm satisfied, I'm full signal to the brain. And so people often describe this as the food noise going quiet, that constant mental chatter about what's my next meal going to be? What am I going to eat next? Oh, I'm craving this or that. And that kind of obsessive thinking about food, it dampens it significantly for many people.
Yeah, and this is what most of my patients will tell me, Shaz. It's not that they necessarily are eating much less. They end up eating less, but it's that chatter that can occupy a lot of time and space for them. The main medications that, let's get into the actual names of what's available in Canada. So specifically, the ones that we all know about there's 3 injectable medications. There's semaglutide, which is a generic form of, it's also known as Ozempic or Wegovy. There's tirzepatide, which is Mounjaro or Zepbound, and then liraglutide, which is Victoza or Saxenda. They all have different brand names, but they're generally approved for diabetes or weight loss. There's also a pill version of semaglutide called Rybelsus, but it's not used as often because the absorption is variable in the gut and it's less considered to be less effective. The exciting news now in Canada is just recently, Health Canada has approved the generic version to be available. It's not yet available in stores or in pharmacies, but it will be in the coming months.
And so I think let's dig in now to like why everybody is talking so much about this now. And like this class of drugs has been around for over a decade. Like you said, Sheila, like it was first approved for the management of diabetes, and it is a very, very effective medication that's been around for many, many years for diabetes. But a few things kind of collided to create this cultural moment for this like new wave of like talking about these GLP-1s. And so first, the clinical trial results for weight loss were genuinely unprecedented. Like we've never had a medication work this well for weight loss. And so there was a big, strong wave of like just increase in popularity based on just that data. Second, of course, social media. So people started sharing their experiences, their befores and afters, the side effects, like really keeping it real. And this really created a massive public conversation around GLP-1s. And then third, celebrities. So whether they admitted it or not, GLP-1s have really become a part of the cultural conversation around body transformation in Hollywood.
Yeah, we see this all the time, right? People will often describe it. And I know you and I have talked about this before, like we shouldn't be commenting on people's bodies, but it is certainly something that is noticeable. And a lot of times people attribute this to the GLP-1s. The big piece that I find really interesting, Shaz, is that beyond weight loss and blood sugar management, these drugs actually seem to have an impact on other things. So heart
this part's
disease
exciting
prevention,
for me to learn
super
about.
exciting, right? And so this is what's interesting. I'm noticing a lot of my specialist colleagues in cardiology, and you might notice this in the Emerge, cardiologists, nephrologists, they're also suggesting these medications because of the other potential benefit on inflammation, on heart protection. And we're going to get into that today. Shaz, you recently, and I want to talk about this too, because there's been a lot of buzz around peptides and everybody wants a peptide. People are buying it online. You did a really awesome post recently on social media about this. Can you tell us about what peptides are and how they're related to GLP-1s?
Yeah, I think so. And like, let's have like just a little sidebar on peptides, because this word is being thrown around a lot, especially in like the wellness influencer space. And it can be confusing because technically GLP-1 medications are peptides. So let's take a step back, talk about what peptides actually are. So really simply put, they're a short chain of amino acids. So amino acids are these protein building blocks in the body. Your body actually makes thousands of them naturally, and they act as these signaling molecules, kind of like as messengers for the cells telling them what to do. And when people talk about peptides, kind of in the weight loss or anti-aging space, they're usually referring to these research compounds in specific that are like used often off-label and sometimes in these gray market spaces to achieve reportedly similar effects. And so some of the ones that you'll hear about are BPC 157, which is being studied right now for gut healing and inflammation, and TB 500, which is being studied right now for tissue repair. Another one is AOD 9604, which is a peptide fragment that's being explored for fat metabolism. And so this is like when people talk about, you know, the umbrella term of peptides, like those are the three most common ones that they're talking about. And these are then like, there are compounded versions of semaglutide as well, which kind of have exploded during the Ozempic shortage, and then now has like really pushed this generic market for semaglutide as well. But the important point here that I want our listeners to make note of is, other than semaglutide and those other two, you know, GLP-1 peptides that you mentioned, nothing else has been approved by the FDA or Health Canada in the same way that these initially brand name medications, and now we're starting to get generics approved as well. They exist, like those GLP-1s exist in a much more complex regulatory space, which is exactly why so many of your questions about safety, which we're going to get into, are so important right now. Another piece that I want to mention, and so, I mean, like, please go back and refer to that, that post that I made. Like, these aren't regulated. None of them have actually had large human studies for them.
This is the concerning part.
This is the concerning part. There is no long-term safety data. The human studies are on the order of like dozens of people. Whereas if you think about like medications, like Ozempic, for example, this is like on tens of thousands of patients over many, many years, with ongoing like aftermarket monitoring as well to look at like side effects and any sort of additional adverse events that were not seen in the, you know, the initial studies. None, like we are not even anywhere near that phase for these other peptides right now. And so that's like a word of warning. And then I think from like, especially when it comes to long-term safety data, keep in mind that because these haven't been studied long-term, we actually know from like a biochemical standpoint that peptides can actually be cancer causing. So there are several known peptides that are known to increase cancer cell growth and spread. And though these two peptides haven't specifically been studied because there is no long-term human data, they're absolutely a theoretical risk that we won't know about until they undergo that rigorous study and undergo that like long-term studying to see if there are any signals in terms of cancer causing potential. So like, as much as when we talk about like the health and wellness space and like the latest fad, it is important to remember that some of these things can cause significant harm, and like cancer is a significant harm. And so we can't forget about those things and why the importance of regulation is so important to keep in mind.
What was interesting about the cancer piece is that because the peptides seem to increase blood flow to cells, which is why it can help with healing, and gut healing is how it's being sold. It's not necessarily discriminatory towards what is it healing and what is it giving blood flow to. So if you have a small microscopic cancer or something along those lines, the worry is that you're increasing vascularization or blood flow to potential cancer cells. And that is the challenge with this. Is that correct?
Yeah, exactly. So something that could be like a slow growing cancer or something that would take, a long time to progress. This could theoretically, because it is increasing blood flow and potentially increasing like growth signaling to all cells, like they don't discriminate, like these peptides are not discriminatory. It could actually cause what might have been a mild or like easily detectable or treatable cancer to accelerate quite rapidly. Because these peptides actually like signal cell growth, they signal cell spread as well. So like it could actually cause spread of a cancer that wasn't necessarily going to spread. So like it is like muddy, but certainly a concern that needs to be, I think, talked about more in this space.
For sure. Because people are buying this stuff over the counter or online.
And like, that's the other thing, right? I mean, before we kind of dig right into the questions here, like from an online sales standpoint, because these are not FDA and Health Canada regulated compounds, you actually don't know what you're getting. You have no idea what the purity is of what you're getting. You have no idea if the dose of what they're saying is actually accurate. You have no idea if what they say that they're giving you is actually what is being sold to you either. And so that is why you and I often talk about the importance of like regulation and FDA and Health Canada approval. This is why it's important.
For sure.
Okay, so I want to get it like right. We got so many questions. So when I posted this like Q&A box, there were like dozens and dozens of questions that came in from our listeners about all things kind of GLP-1 and peptides. And so we did kind of categorize them into categories to try to answer as many of your questions as possible. And we had a lot of questions about the safety. And so in terms of like, so one of these questions are they truly safe? And the honest answer for GLP-1s is for most people, yes, they are, with appropriate medical supervision. So that is the caveat. So these medications have been studied for over 15 years in the context of diabetes. We have solid long-term data with that population.
Yeah, and for weight loss specifically, so separate from the diabetes data, that goes back about 5 to 7 years with very robust clinical trials. And so the safety profile is reassuring. And we know whenever you're seeing this in the emerge as, or I'm seeing patients after I've started them on these medications, the most common side effects that they'll get are things that are related to the gut, because again, GLP-1s are in the gut. And so they're gastrointestinal side effects of nausea, constipation, vomiting, diarrhea. And these things tend to be dose dependent, meaning that we generally like to start low dose and build up because we know that this can be a side effect, and they tend to improve over time.
For sure. And the most serious risks that are listed are things like pancreatitis and gallbladder issues. And I have seen those in emerge. And typically those have been, like you said, like early on, where, the patient is not quite used to the dose yet. The body's still trying to adjust to it. And so that's typically what I see is either as someone has just started one of these GLP-1s, or they've increased their dose recently. That's when I've seen things like pancreatitis or gallbladder issues. There are some animal studies that show that another serious side effect can be thyroid tumors, but this is quite rare in humans. It's been kind of a signal that's been seen in animals, but very, very rare in humans. And so important to note that people with a personal or family history of medullary thyroid cancer or a condition called MEN2 should not take these medications, which is why it's really important to do this under the guidance of medical supervision.
So whenever I'm starting these medications, I always ask about family history of thyroid issues. I do a thyroid exam. That's not part of the guidelines, but I tend to just do that as part of my workup just to make sure that we're covering all our bases. The key word in all of this, Shaz, is supervision. And these aren't medications to get from a spa or from online or borrow from a friend, because it's important to get this from someone who knows your medical history and can follow you over time and adjust the dose accordingly. So let's get into our next question, which is an excellent question as well, in terms of somebody wrote in and said, what are the long-term risks?
This is a really great and honest question. I'm glad that this was asked. We actually had quite a few people ask this question, and we want to give you an honest answer. We actually don't have that 20-year data yet. From a diabetes standpoint, it's been studied for about 15 years. Sheila, as you mentioned, it's about, 5 to 7 years from a weight loss standpoint. So we don't have that really long-term data yet. These medications we know in their current form haven't been used for weight loss long enough for us to have that data.
Yeah, what's interesting in terms of this, in terms of long-term side effects or outcomes, is that when we look at heart health, the 5 to 7 year data actually shows very favorable effect on the heart and a reduction in heart attacks and strokes in the people who are taking it, which is why we're seeing more cardiologists suggest this medication beyond just the weight loss changes. So right now at this time, we're not seeing longer term implications, but again, we do have to wait out the data, to be honest. The area researchers are still watching really closely are the long-term effects on things like muscle mass changes, bone density, kidney function in certain populations. And again, you mentioned earlier, Shaz, about the thyroid issue. That's something that we're keeping an eye on as well. So far, there's no issues that have been raised, but we still have to continue the surveillance to make sure that we're doing due diligence to get that long-term data.
Okay, so let's move on to our next question, which you kind of mentioned in the side effects a little bit. So the question from a listener is that they've had gastro issues on Ozempic twice. And so does that mean for them that GLP-1s are a no-go?
Yeah, this is one of the most common reasons people stop taking it, or they'll call me after they start taking it just to find out what's happening. Now, we certainly have a conversation ahead of time, and I go through the risks and benefits of the medications, including, GI side effects or gastrointestinal side effects are likely the most common thing that you're going to see. And again, this happens when we stop the dose or when we escalate the dose or increase the dose over time, because over time we start low and then we go up. Mm-hmm. They're really the most common reason people stop taking these medications. And what I tend to do, Shaz, when people are coming in with these issues, we go back through the dosing and we review things and we slow it down. So usually with something like semaglutide or Ozempic, we start at a low dose like 0.25 milligrams and we go up every month. So we do it weekly. And then for 4 weeks, then we go up in dose. And then we do another 4 weeks at the same dose, and then we go up in dose. And we do it really gradually. But for some people, when we start at that dose, they might need 8 weeks to get up to the next level in dosing. They might need 12 weeks, or they might just get benefit of that really low dose level. When we're at a prescription, often we're writing it to do that monthly increase. But for some folks, we actually keep it at a low dose, and we just kind of keep an eye on their symptoms. Once the GI side effects improve and they'd like to go up in dose, then we'll go up to the next level. So there's no specific timeline because it really depends on how your body is managing that. We also look at dietary changes. I suggest things like smaller portion size, lower fat content in diet, avoid lying down, because one of the side effects is and one of the ways that Ozempic works is it slows down transit through your gut. And so you feel full for longer. And so if you're eating a larger meal, you're going to feel kind of gross. And so smaller portion sizes and less fatty content or heavier content might also be helpful for that.
That's really helpful to hear from you as someone who starts this medication often, right? Because for me in the Emerge world, I'm seeing these side effects, but I'm not starting patients on this medication. So that's good perspective to hear from you. I think another important piece for listeners to remember is that different GLP-1s have different GI side effect profiles. So if you tolerate one, you might do better with another and vice versa. And so the other thing to keep in mind is that the oral form sometimes has a different tolerability than the injectable. So there are different options in terms of different formulations of GLP-1s if you are experiencing side effects from one. But if you have genuinely tried twice with the proper dose titration and your GI system is truly not coping, that is really important and valuable information to bring to your doctor, because then they actually might have a different class of medication or like you said, Sheila, a slower microdose titration approach that can help mitigate those side effects for you.
For sure. So Shaz, the next question we had was excellent as well, also related to the GI tract again, because this is the most common symptom people have. And the question is, can GLP-1s damage your digestive system by slowing it down?
Yeah, so this is a great question that I've heard a lot as well. And this refers to a specific condition called gastroparesis, or delayed emptying of your stomach. And this has gotten a lot of attention, especially with some recent case reports and lawsuits that you may have seen in the news as well. And so here's what we do know. We know, we talked about this at the start off the top of the episode, that GLP-1s do slow your gastric emptying. And that's partially how they work. Like, that's how they can keep you full for longer. And for most people, this is mild and manageable. But for a small subset of people, particularly people, with pre-existing kind of digestive motility issues, so like diabetes in and of itself can actually cause gastroparesis. Yeah. So if that's something that's a pre-existing issue that you have, that slowing can actually become problematic for these people.
Yeah, and there's also something called Ozempic stomach, Shaz. I'm not sure if you've heard of that.
I have not heard of it. Let's hear more.
Yeah, so this is when you have like this persistent nausea and motility disruption, even when you stop taking the medication. And so this is where we're seeing data emerging still. It's not very common, but it is something that can happen, and our gastroenterology colleagues are paying attention to it. So after stopping, there can be sort of a lag of your body shifting back to its normal, like pre-medication phase. And so that's something that we're keeping an eye on. If you have a history of any GI motility issues, so you're someone who does have a slower transit to their gut, or there's a prior issue with what you mentioned, Shaz, in terms of gastroparesis, these are critical conversations to have before starting. Mm-hmm. And that's, again, goes back to the point of, instead of buying it online or someone who may not know your history, this is where knowing your clinician and your clinician knowing you and your history is very important. Mm-hmm. So the next set of questions that we had, Shaz, were really around how long do people need to be on this medication, which I love talking about, because anytime we start a medication, we always want to talk about an exit plan for a medication, or at least give people a chance to understand, how long am I going to be on? Is it 3 months, 6 months, or is it forever? And this was the number one theme across your questions. Multiple people asked this in different ways. So the question specifically that we got that I want to ask you, Shaz, is like, do you have to use GLP-1 forever or gain everything back? Another one came in, once you start, will you need it forever? And a third one came in, same theme. If you start, do you have to continue it indefinitely?
This is this is also just, I think, a pervasive question in the ether, when like just generally having conversations with people about these GLP-1 medications. And I really want to be straightforward here. For most people, the answer is yes. So stopping the medication, we know the data shows that it does lead over time to weight regain. So there was a trial, the Step 4 trial, that looked specifically at what happens when people stop taking semaglutide after losing weight. And the participants regained their weight, about 2/3 of their weight, like kind of lost, like 2/3 of the weight that they lost, they regained it within about a year of stopping. And this is where that framing matters a lot. So we know that obesity is a chronic disease. It has a biological basis. And so when you take a GLP-1, you're correcting that hormonal signaling deficit. And when you stop, that deficit returns.
And what I find fascinating, Shaz, is whenever we have this conversation with patients, we don't, when we're treating something like high blood pressure or diabetes or depression, we don't stop those medications once their blood pressure is normalized or once the depression lifts. We certainly may taper medications, but this is a chronic condition. And so chronic conditions require long-term treatment. And for many people, GLP-1s fall into that category. There are some situations with my patients that we'll talk about, like, let's use GLP-1s as a tool during a specific time period to help them build the lifestyle habits, and then we try to taper off. And a lot of times that's because of the cost of these medications. That's quite prohibitive. This tends to work better with folks who may have less weight to lose, and they have a good, strong lifestyle foundation, which is why always, whenever we start these medications, I often pair that with a visit to one of our dietitians to help them kind of build some of those lifestyle measures, again, prior to starting the medication and during as well, because your needs may change in terms of protein. And then in those individuals, we may taper down to get to the lowest dose possible that is effective for them without the regain happening.
Yeah. And so the bottom line here, I think, is like go in with the expectation that this may be a long-term medication, like kind of parallel it in your brain, similar to what you said, like, a cholesterol medication, a blood pressure medication, an antidepressant, and then have that conversation openly with the provider that you're seeing. So I think this is a really good transition to the next set of questions that we got a lot of. And really the overarching theme was, is this right for me? And so this is a question that really got personal. And we love that because that's exactly kind of what we want to hear from you guys. And so the question kind of came about, like, is it good for someone with like less than kind of 25 pounds to lose, in the perimenopause to menopause age range, nothing is working, they have some weight to lose. And so is this the right medication for somebody like that, Sheila?
Yeah, and I think this really highlights that this is a real world situation that I'm often seeing in practice. And, it's complicated by the fact that current FDA and Health Canada regulations are for those. We still use the BMI as a marker, which is not a great marker of health, but it's what we use right now. And the specific criteria to get approval for these medications are a BMI of 30 plus or 27 with a weight-related condition. So if you have a BMI of 30, then that qualifies you for something like Ozempic. Or if you have a BMI of over 27 and you have like high blood pressure, for example, or fatty liver or high cholesterol, then that qualifies you as well. And diabetes on its own qualifies you for this medication. The reality is, though, this is where having a nuanced conversation with your clinician is really important. We know that in perimenopause and menopause, like this question is asking us, there is a hormonal environment that makes weight loss harder in ways. It's really part of aging that weight becomes more difficult. It's not necessarily hormones themselves, but also where fat is deposited in the body changes with estrogen level changing. And that increases the risk of something called insulin sensitivity will change as well. So insulin resistance increases. So the insulin in your body that usually would manage your blood sugar starts to become less effective. And so this is where we see for folks in middle age, the rules that you played by in your 30s don't really apply at this point. So this is where I work one-on-one with my patients to find out, okay, so you're sitting with a BMI that may not meet criteria. Certainly this is something that we have to really have a cautious conversation with. How do we kind of balance that like overuse of these medications for what's called vanity weight versus when there's a real indication for it? And this is really an area that's evolving. It's not officially a protocol, but we all individually will work with you to try sort of make sure that this is the right choice for you in a safe way. This is where I do have some caution with folks when they're using online services. They may not be able to have that nuanced conversation in the same way to make sure that you're getting. That's not true all the time. I know a lot of wonderful docs who do this work online are counseling their patients, but it's just a caution if you're buying these products online without the counseling involved.
Yeah. And I think, another important thing to keep in mind is like physicians can and do prescribe GLP-1s off label for people who don't meet those strict BMI criteria, but have other metabolic concerns. And so if you are, middle-aged, struggling, and have a doctor who takes your concerns seriously, it's a legitimate conversations. But remember, and we've talked about this in previous episodes as well, there are other considerations to take into account as well. And so talk to your doctor also about like dietary considerations. Ask them to be referred to a registered dietitian. Make sure your thyroid level has been tested. Your blood sugar screening is up to date. Sleep apnea testing can certainly have an effect on weight management as well. And so these are important things to address with your doctor as well, to see if there are other things that can be addressed at the same time alongside GLP-1 treatment.
For sure. So this is where, again, when patients come in to talk about their weight or concerns around the metabolic health, we are doing a full, thorough workup. It's not just that they come in and we give you a prescription. A clinician should be asking you these questions. Are you sleeping? What is your level of activity? What is your diet like? Those things all play into it. And then I do check blood sugar, thyroid, and otherwise, Shaz, just to make sure that we're not missing something else.
Now, what about for weight loss during menopause? Like that is a common theme that we got in the questions as well. And so is GLP-1 an option for weight loss during menopause?
Sure. I think this again goes back to where the ideal combination for those, again, we see changes in weight during the menopause transition due to a number of reasons. And so first off, whenever I talk to my patients about weight gain or body composition changes in this time of life, is it related to, you've changed your dietary patterns because you're really tired, because you're having hot flashes at night and you're not sleeping well? We know that sleep is such a hallmark feature. Loss of sleep is a hallmark feature of this time of life. And when sleep is affected, we do see a direct change in how much calories we consume, our activity levels. And so those are the things that we're also seeing that we have to address. It's not just here's your Ozempic, this is going to help your weight loss. We have to address all the other factors. So if you're having hot flashes and night sweats, let's treat those things so we can make sure that you are feeling better to help you make those better lifestyle choices that will also help with the weight changes, and that you can get up and maybe add a little strength training in, which we know helps with metabolism as well. It's not just here's your medication and that's it. It's sort of part of the toolkit that we use, Shaz, rather than just saying that, is it the best way? I would say it's one part of the toolkit that I often will discuss with patients, especially when people have tried other things. They've tried the lifestyle management. We've managed their hot flashes and night sweats and they're still struggling. This is a very viable option. Okay, Shaz, so we had a lot of questions that got into a little bit of the nitty-gritty details about prescribing these medications. I love it because, again, people are on this medication. They have questions about it. So let's get into it. Well, this lovely question came in. Is it possible to plateau while on the medication? What's next if this happens?
Yeah, so great question. And yes, the answer is that it is possible to plateau while you're on the medication. And this often catches people off guard because that early weight loss can be quite dramatic. And so plateaus on GLP-1s are quite common. They are real. And they typically appear around the kind of 6 to 12 month mark where, there is that rapid early weight loss, and then there is this plateau that can happen. And what actually happens physiologically is that your body adapts. Our bodies are like these wonderful, amazing homeostatic things where they adapt at different things that are happening within them. And so your basal metabolic rate will decrease as you lose weight because you're a smaller body. So your body overall is burning fewer calories. And so then the medication dose may actually need some adjustment. Your dietary patterns might have kind of shifted back towards habits that are slowing the process as well. And so that is an important piece to consider. And of course, absolutely have a conversation with your provider about as well.
Yeah, so when people are having that plateau, I'll get a call or I'll see people in my office and they'll say, it's just not working the same way that it did when we first started. I still haven't reached my goal weight. I'm still dealing with some of the metabolic issues that are happening. Let's talk about this. And so if this happens, we sometimes will dose optimize. So if you haven't reached the highest level of dosing, we may bump up the dose. We may switch medications between the GLPs just to kind of see if that might be helpful. And then we always do a lifestyle recalibration. So I'm going to ask you questions around, has anything changed in your diet? Because you've sort of plateaued, have we started to consume some of the things? Has a chatter come back a little bit is what patients will often tell me that they're noticing that come back. The other piece that I mentioned previously is that resistance training is part of this as well. And so it's not just for breaking the plateau, but it also protects your muscle mass because we do see those changes happen potentially with the GLP-1s, but it's also helpful for your metabolism. So always just doing a lifestyle recalibration is helpful at this stage. And again, addressing sleep issues if they are coming up. I really love the next question, Shaz, because this is where we're seeing a lot of things happen in the wellness space about people getting these medications online in tiny doses called microdoses, which are lower than what we usually would prescribe. So GLP-1 microdosing, good or bad? And what does microdosing really mean?
Yeah, so let's start by what it means. So microdosing in this context means using a dose that's significantly lower than the standard therapeutic dose. And so in this context, it's about 10% of the standard dose. And so the standard therapeutic range for semaglutide weekly is between 1 and 2.4 milligrams. And so microdosing would be 0.1 to 0.25 milligrams weekly. And the idea
we start at 0.25 usually for people. That's our starting dose.
And then move up, right?
Then we move up.
Yeah. And so the idea from this kind of microdosing comes from some clinical observation where some patients, particularly those who are smaller, a bit more weight sensitive, or using GLP-1s for kind of maintenance rather than active weight loss, seem to still get meaningful benefit from these very low doses with far fewer side effects. And so, good or bad, not inherently one or the other, but it is something that's important to consider, of course, under medical supervision, and certainly not something to self-prescribe. It's not a universal strategy, but some people find it beneficial, and other people will still need the full dose to see any sort of effect at all. Okay, so one of the big barriers of these GLP-1s is the cost. So big question that has been coming up a lot is how close are we in Canada to getting the generic versions of these medications?
Well, they're here now. So Health Canada's announced it on April 28th this year. They announced that the generic form is approved of Ozempic, so semaglutide. The supply is not yet available as of our taping, but it will be coming soon. Cost is such a big barrier, like you said, Shaz. I think this is one of the biggest reasons why we can't prescribe these medications because they simply are out of reach for most patients, where costs right now currently is anywhere from several $100s per month to several $1,000s for several months of care. And that is out of reach for the majority of Canadians. Insurance coverage often does not cover this medication for weight loss. It will cover it for diabetes, but if you have private health insurance, often it's not covered for weight loss at this time. So hopefully over time, but given that the generic is being approved, it will be, but that's something that we have to stay tuned to.
Okay, so let's get into like the thing that I've actually been most excited about to talk about in this conversation, which is like the kind of uses of GLP-1s beyond weight loss. And so this is an important reminder, like GLP-1 receptors are not just in your gut, they're actually in your brain, your heart, your immune cells. And so although like there are no actual hard indications for any of the things that we're going to talk about in this next section at this time, this is something that is continuing to be studied, and we're kind of watching this emerging data. And we certainly had a lot of questions about this as well. So let's just dive right into it. So Sheila, tell me, GLP-1s and mental health in women, is there something there?
Yeah, this one's really interesting because, as you said, Shaz, GLP-1 receptors are not just in the gut, they're also in the brain and in the parts of the brain that also govern mood and anxiety and reward. So early data does show that some people will experience some improvement in anxiety and depression symptoms. And part of that is what's being hypothesized is around that chatter that's happening. And it quiets some of that thought process. It also seems to reduce compulsive behaviors. And I think this is an area that's really interesting. I do a lot of work in addictions. I know you do a lot of work in addiction work as well. And specifically, they're looking at alcohol use and smoking and compulsive behaviors in the use of these medications. And so there's specific dedicated trials now with GLP-1s for depression, anxiety, and substance use. And I think this is going to be a major story in the next 5 years.
Love that. So interesting.
So Shaz, what about Alzheimer's disease for future prevention?
Yeah, this one's also very interesting, like just what the effects on the brain have been found. And so we know that there are a lot of GLP-1 receptors that are found in the hippocampus or other brain areas that are involved in memory and cognition. And so there are some animal studies that have shown that GLP-1 agonists could actually reduce amyloid plaque accumulation, which is one of the hallmarks of Alzheimer's disease. There are some kind of human observational studies that have shown that people with type 2 diabetes who are also on GLP-1 medications actually had lower rates of dementia compared to those on other diabetes treatments. So although there hasn't been any like randomized controlled trials looking at this yet, it is certainly very, very interesting. And we are just waiting for more data to come out on this. Okay, so let's talk more about other diseases. What about long COVID? I have heard some things about whether GLP-1s could be effective for long COVID. Anything on that?
Yeah, again, another really interesting area of ongoing research. And again, we have to always highlight that these are areas of research. We're not saying that these are the reasons to be on these medications, but it's a really exciting area because there's developments happening month by month that we want to be able to share and be up to date with. Long COVID is thought to be like this persistent inflammation and immune dysregulation that happens after having COVID. And this is where GLP-1's anti-inflammatory effects seem to maybe have a positive effect. And this is what's being studied right now. There's actually clinical studies looking at the use of the GLP-1s in long COVID. And I have patients who have long COVID, Shaz, and it's very disruptive. So I think, especially when it comes to fatigue and cognitive symptoms. And so I think this is a very much, again, watch the space kind of situation. Shaz, another big question that came up, does it have cardiac protective features?
So this one is actually like the most robustly supported data so far. So we know that GLP-1 research actually shows that there is cardiovascular protective effects with GLP-1s. There was a trial called the SELECT trial, which was published in 2023. It had over 17,000 people in it with cardiovascular disease and obesity, and actually showed a 20% reduction in major adverse cardiovascular events. So heart attacks, strokes, cardiovascular death in people taking semaglutide compared to placebo.
And this is remarkable, right? Like I think this tells us a lot around the metabolic health risks that are associated with heart attacks and stroke. And this is again why many of our cardiology and kidney colleagues are taking these medications very seriously beyond just weight loss.
Last one I want to talk to you about kind of like emerging uses is on kind of inflammation and women's health. So things like endometriosis, menopause. Is there any data there, Sheila?
Yeah, so GLP-1s do seem to have some anti-inflammatory effect beyond their metabolic effect, like we've talked about, kind of scattered throughout our conversation today, Shaz. And this is where we know endometriosis is an inflammatory condition. And so there is a theoretical benefit, but again, it needs to be further studied. So it's not a treatment for endometriosis at this stage, but it's very curious to see because a lot of my patients with endometriosis, they're suffering so much and this might be something in the future. So again, we need to watch and wait here.
Love it.
Okay, we also, to end off our questions, thank you for sending them in. We had a bunch of questions that were a little bit surprising and very interesting. So I'm excited to answer this with you, Shaz, because there were some really honest questions.
So this one was a very honest question. So do GLP-1s cause your genitals to lose fat and droop or waste away?
So I appreciate this because I think this is a question that people do have but are afraid to ask. And if you're asking it, other people are also wondering the same. And the short answer is, rapid weight loss of any kind, so related to GLP-1s or otherwise, can cause changes in fat redistribution throughout the body, including in the genital tissue. So fat loss can happen in the mons pubis area and the labia, and it can be a real thing that people experience.
And I think this is also related to that broader conversation about like Ozempic face and Ozempic body, the idea that this rapid weight loss can cause skin laxity and volume loss in areas where we actually want to maintain some fat, right? And so like fat in the face, certainly like if you're wanting to maintain like this youthful appearance, like that is a positive thing. And so some mitigation to that is like losing weight gradually, maintaining estrogen levels if you're perimenopausal, and then make sure, of course, that you're having adequate protein and hydration as well.
And I'd be remiss, I try to mention vaginal estrogen in every conversation that I have. If you're noticing changes in those tissues separate from weight loss, just as part of aging and genital urinary syndrome and menopause, vaginal estrogen is an excellent way to help preserve those tissues as well. So what about bone density problems, Shaz?
So this is one that has honestly been in a lot of the conversations, and it's often an overlooked but really important concern. And so rapid weight loss from any cause can lead to bone density loss. And there's a particular concern for postmenopausal women who are already at higher risk for osteoporosis. And so then it's just important to think about what the protective strategies are there. So making sure you have adequate calcium and vitamin D intake, that weight-bearing resistance exercise that you've brought up multiple times already, which is the single most important thing you can do for your bone density. And if you're postmenopausal, discussing bone density monitoring and potentially hormone therapy with your doctor. So don't skip out on the DEXA scans. It's important to know your baseline, especially if you're going to be starting to take one of these medications.
And I love this question, Shaz. Do you think everyone will be on these eventually?
This is an important philosophical question, and we love it because you guys really know how to keep it real. I don't think we don't think that everyone is going to be on these medications, but we do think that GLP-1s are going to become much more commonly prescribed medication, like similar to statins or blood pressure medications within the next decade, because the disease burden is so enormous. We know these medications are effective and they work. And then as they become more accessible from a cost standpoint, I think the access is going to expand as well.
Yeah, the only thing I'd add to that, Shaz, is like we'd push back on any narrative that these medications are for everybody. Medical decisions are individual. We need to have a nuanced conversation with your clinician based on your clinical history, your own medical history, your family history, and otherwise. But what is really important is that the stigma around using medications to treat obesity needs to end. We do not stigmatize people for taking medication for any other chronic disease.
Exactly.
And this should be no different. So the last question that I thought was really interesting was like, what would you do, Dr. Shaz and Dr. Sheila? Would you take them if they were needed?
So I love this question because, again, it's like keeping it real and like kind of getting us off the hedging, right? And so for me personally, if I had an issue that was weight related that led to a metabolic condition or significant cardiovascular risk, or was like genuinely struggling with my weight despite my lifestyle efforts, like you know that I'm an active person and that I do everything I can for my metabolic health. But if that still wasn't enough, I am confident in the data that it supports the use. And so I absolutely would. What about you?
Yeah, same. Absolutely the same. And I think, as South Asian women, this is like we have a higher risk of heart disease and stroke. I have a very strong family history of this. So this is something that I'm actually actively thinking about. I'm also perimenopausal and my weight distribution has changed and I'm looking at these options as well. So I do think working with my own clinician, it is a conversation that is important to have, especially as we see more data points come out in the future as to the other potential benefits as well. And that brings us to the end of today's episode and the end of season 2 of the Doc Talk podcast. We want to thank you so much for all of you for engaging with us this season, for sending us your questions, especially for today's episode. They were so smart, they were personal, and they were really honest. And they showed us that you're asking the right things about your own health so that you can get the care that you need.
And, our biggest takeaway from everything we've covered today is that GLP-1s are genuinely a significant development in medicine. They work, they have real benefits that extend far beyond just diabetes and weight loss. And for the right person with the right medical guidance, they can absolutely be life-changing.
But they're not magic. They're not for everyone, and they do come with real life considerations like side effects, long-term use, and cost, and the importance of doing the lifestyle measures alongside a medication.
So if there's one take home that we can send you home with, please have these conversations with a doctor who knows you, not your neighbor, not a wellness influencer, not a spa that's prescribing without blood work, a real clinician that knows your history in front of them.
And thank you for an incredible season. Thank you for trusting us with your questions. Please take care of yourselves, and we will see you next time for season 3.
Thank you to everyone for tuning into the Doc Talk today. A reminder that the Doc Talk is for general information purposes only. This podcast is not intended to replace medical advice from your doctor. While we are doctors, we are not your doctor. Always speak to your own healthcare provider for questions related to your personal health needs. And make sure to follow us on social media at the Doc Talk Pod. And of course, be sure to like, subscribe, and review us wherever you get your podcasts.